My name is Jake. I'm going to be performing head to toe on you today. This is a pretty lengthy exam, so do you need to empty your bladder before we get started?
No.
Can you tell me your name?
Darren.
This is Darren. Off his general survey, he is symmetric, body is well aligned, he looks calm and relaxed, comfortable for the exam. Head is erect. Skin color looks normal upon general assessment, and as he was walking in here, I observed his gait. It was steady and even. Now, Darren, can you tell me your date of birth?
5/20/1992.
Can you tell me where we're at right now?
We're at the UK hospital.
Can you tell me who our current president is?
Trump.
Can you tell me the current year?
It's 2025.
Okay, patient is oriented and alert with clear speech, knows person, place, and time. Now, could you tell me what you would do if you had blue lights behind you?
I would pull over.
Perfect. So, patient has good judgment. So now I'm going to start my exam. Darren, I'm going to start by inspecting your face. So I'm going to inspect his face with even symmetry. Do you care to take off your glasses for me? And close your eyes. Okay, external eyes look good. Lids cover over eye completely. Now open your eyes. Sclera is white-ish, reddish. Now I'm going to look in your conjunctiva. Pull your face down a little bit. Conjunctiva, pink and clear. Pupils are about a 4. Now, inspecting his head is symmetrical, well aligned. Hair is evenly distributed. Now I'm going to palpate. I'm going to touch on your head, okay? No sutures present. Head is rounded. Hair is evenly distributed. Little bald spot right here. I just messed up his hair too, so I'll fix that. Everything looks good. All right, Darren. Now, I'm going to get a set of vital signs on you. So I'm going to feel your pulse for about a minute, okay? And when I'm done feeling his pulse, I'm going to assess his respirations while holding a pulse. Just over a minute. I'll do it for 30 seconds after the minute. Alright, so we're at a minute. Pulse was 68. Now assessing for respirations. Patient took 7 respirations in 30 seconds, so multiply that by 2. Patient's respiratory rate's 14. Chest rise and fall was equal and clear. Now, I'll set my blood pressure cuff over here, but I'm going to get a temperature on you first. This temperature. Temperature is 98.9. Now I'm going to take a blood pressure. First, I'm going to get his palpable systolic. Palpable systolic. About 140. Give him a second. Cuff completely empty. Alright, now I'm gonna get a blood pressure. It's gonna get real tight on there again. So, diaphragm. Patient's blood pressure is 124/74. Take my blood pressure cuff back. Now, since I already inspected and palpated his head and inspected his outer eye, I'm going to have him do his near vision with a Rosenbaum. So we're going to do his corrected vision with his glasses on. If you can, just hold this 12 to 14 inches away from your face. And can you cover your right eye and read the lowest number you can read?
426739.
Perfect. That is 20/20 vision. Now can you cover your left eye?
426739.
That is 20/20 vision. Now can you do it with both eyes?
426739.
Awesome. So patient is 20/20 in right and left eye and both at the same time. Now can you take off your glasses for me? Now I'm going to make sure his pupillary constriction, well first off his pupil size is about a 4. I'm going to make sure his pupillary constriction is direct and consensual when I shine the light in one eye, then the other eye, making sure both eyes constrict. Ready? It's going to be a bright light in your eye. Okay, moving to the other side. Sorry, I just shocked him. Good. Perfect. Pupils constrict equally and consensually. Now I'm going to have you look at my finger. Then can you look at the wall behind me? Back to my finger and back to the wall. Okay? Eyes constrict when looking back at the finger. Therefore, they are accommodating and perla. Now I'm going to take a look in your eye for the red light reflex using my ophthalmoscope. So assessing his right eye, I'll use my right eye. Okay, red light reflex present. Testing his left eye, use my left eye. Red light reflex is present. Now I'm going to inspect his, I'm going to inspect your nose first. So if you will look up for me. Okay, nares look patent, septum is midline with no deviation, hair is evenly distributed, and mucosa is pink. Turbinates are visual. Now, if you wouldn't mind, can you cover one nostril and breathe in for me? Perfect. Now can you cover the other nostril and breathe in? Okay, so sniff test is equal with no signs of blockages. Now, I'm going to inspect and palpate your ears. So you're going to feel me touching on your ears, okay? Pinna is firm, tragus is firm, lower lobe is soft. Did you have any tenderness?
No.
Okay, now we're going to perform the whisper test while we're at your ears. So what I'm going to do is I'm going to say 3 words to you, whisper 3 words to you, and you're going to repeat them back to me, but you're going to cover one ear, okay? All right, so cover your left ear for me. You ready? Basketball, Texas, football.
Basketball, Texas, football.
Perfect. Now can you cover your other ear? I'm going to whisper for you. Volleyball, soccer, baseball.
Volleyball, soccer, baseball.
Perfect. Whisper test is accurate on both sides. Now I'm going to palpate your sinuses. First going above the eyebrow. You tell me if you have any pain or tenderness, okay? Any pain?
No.
Then below the eye. Any pain or tenderness?
No.
Okay, perfect. Now we're going to move to your neck. And I'm going to inspect your head and neck, okay? So neck is same color as the rest of his body. With a beard, trachea appears midline. Carotid pulse is 2 plus left side, regular rhythm and rate. And 2 plus right side, regular rhythm and rate. Now I'm going to ask you to tilt your head up, and I'm going to palpate along your trachea, okay? You tell me if you have any pain or tenderness. Any pain or tenderness?
No.
Okay, trachea has no pain or tenderness, no mass is felt, and it is midline with no deviation. Now I'm going to ask you to take a sip and hold this water, okay? Hold it in your mouth. Come back, set it over here. Now can you tilt your head back for me? And go ahead and swallow. Okay, thyroid assessed with no masses felt at all. Do you have any pain or tenderness in your thyroid?
No.
Okay. Moving back to the ears real quick. I'm going to take a look in his ears. So I can get one of these little plastic things out of the bag. Maybe. I'm going to pull your pinna up and back, taking a look in the ear, examining his tympanic membrane, which is pearly white. Cone of light is spotted, some cerumen present and hair present throughout. I'm going to take a look in this other side. Oh, as I break our machine. Okay. Take a look in this ear. Tympanic membrane is pearly gray, cone of light present, cerumen present, and hair present throughout the ears. Back here. Okay, now I'm going to take a look at your mouth. Mouth is even and symmetric with no dryness. Now if you could open your mouth for me. Teeth are white, well aligned. Let me get a tongue depressor. I'll put my tongue depressor over here. Oopsies. This tongue depressor. Now can you open your mouth for me? I'm gonna put this on your tongue and say ah, ah. Okay. Uvula moved. Oropharynx pink and clear. Soft and hard palate present and intact. Now I'm going to take a feel of your lymph nodes if I can get my pin on that. Alright, I'm going to feel your lymph nodes in your neck, okay? So we have the pre-auricular, any pain or tenderness?
No.
Post-auricular, any pain or tenderness?
No.
Tonsillary, any pain or tenderness?
No.
Submandibular, any pain or tenderness?
No.
And submental, any pain or tenderness?
No.
Perfect. Now I'm going to assess your upper arms. So, feeling warm, dry, even bilaterally. Color is the same, hair dispersed the same bilaterally. Taking a look at his cap refill. Cap refill is less than 2 seconds in all 5 on the left side. Less than 2 seconds on all 5 on the right side with no clubbing. Angle of the nail about 160 degrees. Now I'm going to feel his left radial pulse. 2 plus. Left brachial pulse. 2 plus. Right brachial pulse. 2 plus equal rate rhythm, and left or right radial pulse. 2 plus equal rate and rhythm. All right, now I'm going to ask that you hold your arm out for me, and I'm going to palpate some more lymph nodes. So this is his lateral lymph nodes. Any pain or tenderness?
No.
Central lymph nodes. Any pain or tenderness?
No.
Pectoral lymph nodes. Any pain or tenderness?
No.
And then I'm going to do subscapular in the back. Any pain or tenderness?
No.
And infraclavicular in the front, any pain or tenderness?
No.
Infraclavicular on the right side, any pain or tenderness?
No.
Subscapular, any pain or tenderness?
No.
Then pectoral, any pain or tenderness?
No.
Central, any pain or tenderness?
No.
And lateral, any pain or tenderness?
No.
And while I'm assessing your lymph nodes, I'm going to go ahead and assess some more. I'm going to do your clavicular lymph nodes, any pain or tenderness?
No.
Deep clavicular, any pain or tenderness?
No.
And then any pain or tenderness right here is subclavicular?
No.
Okay, perfect. Now, I'm going to ask if you can get up and go to the other side for me, and I'm going to take a look at your back. Where are you at? Just hit a 180. Okay, back seems equal and symmetric. Spinous processes present. The muscles, vertebral muscles present. Can you go ahead and take a deep breath in and out, checking for symmetry? Equal and symmetric. AP diameter is regular, about 1 to 2. All right, Darren, now I'm gonna tap on my fingers on your back. I'm gonna palpate your back in all 10 areas along the back. Palpate your lung fields. You ready? Any hurting?
No.
Any pain?
No.
Tell me if there's any pain. Any pain or tenderness?
No.
Okay, and the sounds were resonant throughout. Now I'm going to auscultate his lung sounds in those same 10 spots using the diaphragm and my stethoscope. Deep breath in and out. Deep breath in and out. I want to alternate sides. Deep breath in and out. 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 Deep breath in and out one more time. And deep breath in and out one more time. All lung sounds are clear throughout. Now, Darren, I'm going to take a fist and kind of punch on my hand here on your lower back. You tell me if you have any tenderness, okay? Testing this costovertebral angle. Any pain?
No.
Any pain?
No.
All right, perfect. Now I'm going to ask that you just lay on the bed normally if you can. I'm going to drape you up. Put a blanket on you. Okay. Perfect. Now I'm going to start by taking a look at your chest. So I'm going to unstrap this one real quick. Oh, goodness. Take a look at his chest. It's warm, dry, skin color the same, hair evenly distributed the same. It's a reddish with olive undertone skin. Now I'm going to go over and palpate over the heart for any thrills, heaves, or lifts. None felt. Now I'm going to feel out his PMI for 1 minute. PMI is at the 5th intercostal space, mid-clavicular line. Okay, it's been a minute. 2+ amplitude at a rate of 68. Now, can you take a deep breath in and out? Do that one more time for me. All right, respiration is consistent. He has no grunting or bulging in these chest, in the frontal chest. Now I'm going to take a listen to all quadrants using the diaphragm, all of his lungs, so all 8 spots on the front. Deep breath in and out. Going back and forth and comparing. Deep breath in and out. Deep breath in and out. Deep breath in and out. Now my breath in and out. Deep breath in and out. Deep breath in and out. And deep breath in and out. And it's at this point, if I had a female, I would perform a breast examination. So I would examine using 3 fingers, noting if there's any nodules, looking for symmetry in size comparison, making sure they're equal. I would assess the tail of Spence, which goes from about shoulder down and assessing the nipple. And then I would teach a breast self-examination, which should be done in the shower, after your period, and while laying down. So you should do 2 a month. 1 in the shower and 1 while laying down. And then now I'm going to auscultate heart sounds using diaphragm and bell. So I'll start in the aortic area using the diaphragm on the right sternobordar. Then I'll move to the pulmonic area, second intercostal space, same as aortic, which was second intercostal space, right sternobordar, second intercostal space, left sternobordar for pulmonic. Third intercostal space, left sternobordar for Erb's point. Fourth intercostal space, left sternobordar for the tricuspid. And fifth intercostal space, mid-clavicular line for the mitral valve. That was with the diaphragm, S1, S2 noted, regular rhythm, no abnormal heart sounds. Now I'm going to listen for murmurs with my bell in the same locations. Aortic, pulmonic, Erb's, tricuspid, and mitral. No murmurs present, all heart sounds are equal. Now I'm going to ask if you can flex your knees, and we're going to do an abdominal assessment. So we can cover this back up, sorry. Put this back on for you. First I'm going to inspect. Abdomen is flat, coloration is equal, and warmth, it's warm and dry. No obvious bulges or abnormalities. Now I'm going to auscultate, starting in right upper quadrant, then left upper quadrant, right lower quadrant, left lower quadrant. Listening with the diaphragm. Bowel sounds present in all 4 quadrants. Now I'm going to flip over to the bell and listen for any bruits in his aortic, renal, and femoral arteries. So aortic, present, renal, bruit, left renal, bruit, femoral, and while I'm at your femoral arteries there, I'm going to go ahead and palpate for them, okay? 2 plus right femoral, regular rate. 2 plus left femoral, regular rate. Now I'm going to percuss, starting in the right upper quadrant, then left, right lower, left lower. Patient is tympanic throughout the abdomen. Now I'm going to do some light palpation. You tell me if you have any tenderness, okay? Tenderness?
No.
Any tenderness?
No.
Tenderness?
No.
Tenderness?
No.
Okay, now I'm going to do some deep palpation. First, we'll start by seeing if I can palpate the liver. Do you care to take a deep breath in and hold? Liver is not palpable. Go ahead, you can exhale. Palpating the aorta. Aorta is also not palpable. Now I'm going to do deep palpation starting in the right over quadrant, left over quadrant, right lower quadrant, left lower quadrant. Any pain?
No.
No masses or nodules felt on light palpation. Any pain?
No.
Pain?
No.
Pain?
No.
No pain or tenderness reported on deep palpation and no masses or nodules felt. Now if you don't care if you can put your legs down and lift your neck off the pillow, I'm going to check for a hernia. No hernia present. So now you can cover that up and we will move to the lower extremities. Cover it up. Alright, lower extremities, warm, dry, coloration equal and on both sides bilaterally. No edema bilaterally upon palpation. Now I'm going to feel your pedal pulse on this right side. It's 2+ regular rate and rhythm. Posterior tibial, 2+ regular rate and rhythm. Left pedal, dorsalis pedal, regular rate and rhythm, 2+, and then left posterior tibial is 2+ regular rate and rhythm. Now I'm going to check your nails for capillary refill. Cap refill less than 2 seconds in all 5 nail beds on the left, and less than 2 seconds in all 5 nail beds on the right. No signs of clubbing, nail angle 160 degrees. And now, cover you back up. I would perform a male genitalia assessment, assessing vas deferens, epididymis, and meatus and testicles. So assessing meatus location, whether it's on top, hyperspadias, hypospadias, or normospadias, making sure there's no discharge, feeling for any lumps or nodes on penis and testicles, and I would teach him how to do a self-examination, which you should do in the shower or just after the shower in front of a mirror, and you should be palpating your penis and balls, checking for any and testicles, checking for any lumps, masses, anything out of the ordinary. Sound good? You should be doing that monthly.